B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Good morning, Ms. Rodriguez. I understand that you've been experiencing some concerning symptoms lately. Can you tell me more about them?
Yes. I've been having tingling sensations in my limbs and difficulty with coordination. It's been affecting my daily life and causing me a lot of discomfort.
I see. Those are common symptoms of multiple sclerosis. Have you noticed any changes in your vision or cognitive function?
Yes, I have noticed that my vision has been blurry at times, and I've been struggling with memory and concentration.
I see. We'll perform some tests to evaluate the presence of the disease and determine the cause of your symptoms. It's important that we start treatment as soon as possible to improve your quality of life and prevent complications.
Okay, that sounds good. What are the treatment options for multiple sclerosis?
The treatment options for multiple sclerosis involve managing the symptoms through lifestyle changes and medication. We may recommend changes to your diet, such as reducing intake of certain trigger foods, and stress reduction techniques, such as meditation or therapy. We may also recommend medications to manage the symptoms and slow the progression of the disease.
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
In addition to heart disease, poor oral health has also been linked to other health conditions such as diabetes, respiratory infections, and even dementia. This is because the bacteria in your mouth can also travel to other parts of your body and cause inflammation and infection. Furthermore, neglecting your oral health can also impact your mental health. Chronic pain or discomfort from oral issues can lead to anxiety, depression, and other mental health conditions that affect your overall quality of life. So, what can you do to maintain good oral health? It's simple. Practice good oral hygiene habits such as brushing twice a day, flossing daily, and visiting your dentist regularly for cleanings and checkups. By doing so, you can prevent gum disease, tooth decay, and other oral health issues that can impact your overall health. In conclusion, taking care of your oral health is crucial for maintaining your overall health and well-being. Don't neglect your teeth and gums. Make oral hygiene a priority in your daily routine, and don't forget to visit your dentist regularly. Thank you for listening, and I hope this talk has inspired you to take better care of your oral health.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
Nerve stimulation therapy works by disrupting the pain signals sent by the nerves that are causing your headaches. Botox injections work by blocking the release of chemicals that cause inflammation and pain in the brain.
Are these treatments safe?
Both nerve stimulation therapy and Botox injections are considered safe and have been approved by the FDA for the treatment of chronic migraine headaches. However, as with any medical procedure, there are risks involved. We will discuss these risks in detail if we determine that these treatments may be appropriate for you.
Okay, that sounds good. Is there anything else I can do to manage my symptoms?
Yes, there are some self-care techniques that you can use to manage your symptoms. These include getting enough sleep, staying hydrated, avoiding trigger foods and beverages, and practicing relaxation techniques such as deep breathing and yoga.
Thank you. I feel better knowing that there are many different treatment options available to me. I'm looking forward to working with you to manage my symptoms and improve my quality of life.
It's my pleasure, Mr. Johnson. We will work together to find the best treatment plan for you and monitor your progress closely to ensure that you are receiving the best possible care.
Now look at question 28. You will hear a part of a speech given by a healthcare professional. Now read the question.
In addition to pain management, physiotherapy can also help to improve mobility and strength. After an injury or illness, it's common for patients to experience muscle weakness, stiffness, and reduced range of motion. Physiotherapy interventions such as stretching, strengthening exercises, and balance training can help to restore mobility, improve muscle strength, and reduce the risk of future injuries. Another key benefit of physiotherapy is its role in preventing future complications. For example, in patients with chronic conditions such as arthritis or diabetes, physiotherapy interventions can help to manage symptoms and prevent further deterioration. Similarly, in patients who have undergone surgery, physiotherapy can help to prevent complications such as blood clots and respiratory infections. Finally, physiotherapy can also play a crucial role in promoting independence and quality of life. By improving mobility, reducing pain, and enhancing physical function, physiotherapy can help patients to perform daily activities more easily and with greater confidence. This, in turn, can lead to increased independence, improved mood, and a better overall quality of life. In conclusion, physiotherapy is a critical component of rehabilitation and recovery. By addressing pain, improving mobility and strength, preventing complications, and promoting independence, physiotherapy can help patients to achieve their goals and improve their overall quality of life. If you or someone you know is struggling with an injury or chronic condition, consider seeking the help of a physiotherapist to get back on the path to recovery. Thank you.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
I do not smoke or drink alcohol. I have no known allergies.
Thank you for that information. Based on your symptoms, I will need to perform a physical examination and take some vital signs. John, your blood tests indicate that you have hepatitis C. I will need to order some investigations to confirm the diagnosis and assess the severity of the disease.
For nursing management, we will have to keep you in isolation and monitor your symptoms closely. You will need to take some medication which I will prescribe to you. Please make sure to take them as prescribed and not miss any doses.
I will also arrange for a discharge plan once we have your test results and determine the appropriate treatment for you.
What kind of medication will I be taking and for how long?
The medication you will be taking is called antiviral therapy, which helps to treat hepatitis C by stopping the virus from multiplying in your liver. The duration of treatment will depend on the severity of your disease and the specific type of medication that we choose for you. Typically, the course of treatment can range from 8 to 24 weeks.
Will I need to be hospitalized for the entire duration of my treatment?
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Good morning. How can I help you today?
Hi, I've been experiencing chronic pain for a while now and I wanted to see if physiotherapy could help.
Absolutely. Chronic pain can be difficult to manage, but physiotherapy can help reduce the pain and improve your overall quality of life. Can you tell me more about your pain and where you're feeling it?
Sure, the pain mostly affects my lower back and neck. It's been going on for a few years now and I've tried all kinds of treatments, but nothing seems to work.
I see. Well, one of the first steps in managing chronic pain is identifying the cause. Have you had any injuries or accidents that might be contributing to your pain?
I had a car accident a few years ago, and I think that's what started the pain.
That could definitely be a factor in your pain. Through physiotherapy, we can work on improving your posture, reducing inflammation, and increasing your range of motion to help manage your pain. We'll also work on strengthening your core muscles to support your back and neck.
That sounds like it could really help. What kind of exercises will we be doing?
We'll start with some gentle stretching exercises to improve your flexibility and range of motion. Then we'll move on to strengthening exercises like planks and squats. We'll also work on techniques like massage and manual therapy to help reduce inflammation and improve your overall pain levels.
Okay, that sounds good. How many sessions will I need?
That really depends on your individual needs and the severity of your pain. Some patients see improvements in just a few sessions, while others may need more long-term therapy. We'll work together to create a custom treatment plan that's tailored to your specific needs and goals.
Great, thank you so much. I feel much better about managing my chronic pain now.
You're welcome. We'll work together to help you manage your pain and get back to doing the things you love.